is on proton therapy and the therapeutic treatment of tumors. Atoms are the basic unit of matter and are made up of three subatomic particles: protons, neutrons, and electrons. In this presentation, we will primarily be focusing on protons, which are subatomic particles of crucial importance. The number of protons makes up the atomic number of an element, and there is at least one in the nucleus of every atom, where they are found with neutrons as indicated by this figure. The protons are represented by blue dots, and each has a positive electric charge. Protons can be used as a type of radiation treatment in combination with chemotherapy, immunotherapy, or alone to target tumors. Tumors, or neoplasms, are characterized by an abnormal growth of tissue. They occur when the body loses control over cell growth and division and can be benign, potentially malignant, or malignant, which is when they are cancerous. Proton therapy can be used to destroy cancer cells at high energy. This is called a synchrotron or a cyclotron. It speeds up protons until they reach certain energy, at which point it shoots protons into the body at a certain depth. The protons have a specific radiation dose and deposit the radiation at the tumor site. Widespread adoption of proton therapy has been slow so far given its technical difficulty and cost. There is little evidence so far that it is cost competitive in today's economy, but it is still a highly effective technology that is slowly spreading. There are currently 16 proton therapy centers in operation in the United States, including at MD Anderson in Texas, Scripps University, and at Loma Linda University just a few hours away. There are 46 centers worldwide.
Proton is useful for treating tumors that haven't spread and tumors that are near important body parts such as the eyes, brain, and spinal cord. It is also useful specifically for treating cancers of the eye, lungs, liver, and brain because its ability to target the tumors is so precise and doesn't affect tissues surrounding the tumor. Proton therapy has 60% less radiation delivered around the tumor, which results in less damage towards healthy tissues and vital organs, whereas radiation tends to affect surrounding organs in X-ray therapy. In the procedure, there is a low entrance dose of radiation causing high target precision. In effect, there is a higher radiation dosage to the tumor, and as a result, a greater chance all the tumor cells are targeted and destroyed. With proton therapy, there are minimal to no side effects such as low blood counts, fatigue, and nausea, compared to X-ray therapy and chemotherapy. There is currently research being done to understand more about what proton-based therapy can potentially do. Topics include determining which cancers can be more effectively treated with proton therapy versus radiation therapy, how chemotherapy can work with proton therapy to be the most beneficial, improve surgical outcomes while reducing radiation side effects, understanding the benefits of high precision treatment with limited side effects and significant for long-term benefits, and comparing the toxicity of proton therapy versus chemotherapy. Breast cancer research focuses on radiation, specifically how radiotherapy is efficacious, but exposes neighboring organs to excess radiation, causing risk of other side effect illnesses. For lung cancer, the research being done is looking at pairing proton therapy with chemotherapy for higher survival rates and lower rates of side effect illnesses. The research conducted is important because it is creating more sources for effective treatment. It is allowing improvement in minimally invasive and less toxic therapies to improve the quality of life for cancer survivors. More funding is necessary because facilities itself are a $125 million project. With such positive results, furthering research on a new process of therapy is essential to have it be the most effective it can be.
Robert Wilson is known as the father of proton therapy. He proposed using accelerator-produced beams of protons in order to treat cancer. Much of the research surrounding proton therapy was developed at Harvard University, where the techniques used to safely treat patients with proton therapy was developed. So now we are going to introduce some of the physics fundamentals behind proton therapy. Understanding interactions of protons is important in order to understand the basic physics behind proton therapy. The three main interactions of protons are Coulomb interactions with atomic electrons, Coulomb interactions with atomic nuclei, which results in elastic scattering, and C, nuclear interactions with atomic nuclei. Notably, protons continuously lose kinetic energy by frequent inelastic Coulomb interactions with electrons. Additionally, most protons travel in a straight line because their rest mass is 1,822 times greater than that of an electron. However, if a proton passes close to the atomic nucleus, a repulsive elastic coulombic interaction deflects the proton from its straight line trajectory. Furthermore, in a nuclear reaction, the projectile proton enters the nucleus, and then the nucleus emits a proton ion or a neutron. In simpler terms, when energized particles, such as protons, pass near the electrons, the charge of the protons attracts the negatively charged electron. This results in ionization. Ionization is a form of electromagnetic radiation. Ionization and ionization energy changes the characteristics of atoms and tissues. This change is actually the basis for proton therapy. Notably, protons lose energy in these ionization interactions with the outer shell electrons. The energy loss can be summarized by an equation formulated by Beth Bloch, shown here. The different interactions characteristic of protons means that the therapeutic dosage of proton therapy differs from other radiation treatments. Compared to other radiation treatments, there is a low entrance dose, which is visible as a plateau seen within the graph. The maximum dose, thus, targets tissues at depth, which is visible in the Bragg peak. A graph can explain the proton's linear rate of energy loss. The curvature arises as protons lose little energy when entering the tissues, as visible in the plateau. However, as they enter the targeted tissue, radiation is deposited until the dose of radiation is discontinued, giving rise to the Bragg peak and subsequent rapid drop. The Beth Bloch formula, depicted on the right, is the formula used to determine energy loss in a typical dosage. So how does all of this work to treat tumors? Tissues contain molecules with atoms as their building blocks. At the center of every atom is the nucleus with orbiting electrons. Thus, ionization can target any tissue in the human body. Ionization changes the characteristics of the atoms and tissues. This change is the basis for proton therapy. This ionization energy damages molecules within the cells, particularly DNA or the genetic material, as seen above. Damaging the DNA destroys cell functions, particularly the ability of the cell to proliferate. Enzymes within the cell then attempt to rebuild the DNA. Cancer cells' DNA repair enzymes are typically inferior to a normal cell's. Thus, cancer cells are more permanently damaged and destroyed.
One of the major advantages of proton treatment is that it allows protons to be directed and deposited by physicians at specific tissue sites using 3D beam patterns. Specifically, protons are energized to specific velocities which determine how deeply the protons will emit radiation. The maximum amount of radiation occurs specifically at the target cells, or the cancerous cells, killing the cancer and limiting damage to surrounding non-cancerous cells. Thus, in medicinal doses, multiple Bragg peaks with different ranges or different doses are used to treat tumors. Shown are proton beam accelerators used for medicinal treatments. Proton therapy utilizes Coulomb interactions, radiation, and ionization, basic physics concepts, to target tumor cells. Although proton therapy utilization in the medical field has been limited due to costs, proton therapy proves promising for the future medicinal applications, as proton therapy targets cancer cells while limiting damage to other non-cancerous cells. Proton therapy is an exciting field of research in the medicinal field that incorporates and integrates both physics and medicine.